All right, class, we're going to talk about another drug here. And this one's actually gotten a lot of prevalence as of late, which, of course, is naloxone, otherwise known as narcan. It reverses narcotics, okay? And for those of you history buffs, if you don't know why I'm putting down why didn't we learn from Hong Kong, check out your history books. So naloxone, again, it's commonly called narcan. And what it is it competes for the receptor sites that a narcotic would normally go for to make you feel good, okay? Without the bad side effects from doing that, okay? So it works against it. An antagonist works against what the medicine that it's going to counteract is commonly for. So again, it competes for those receptor sites within the central nervous system, and it blocks the narcotics. So again, it can't function like it's supposed to, and it completely inhibits the effects of morphine, for that matter, any other opiate-based drug. And I stress that opiate-based drug. It does not work on benzodiazepines. It does not work on anything else other than narcotics. Okay. Now the bad problem is we got a lot of narcotics out there. So again, and we're going to talk about that when we get to the uses here in just a second. So our onset of action is usually 2 minutes IV, and between 2 to 10 minutes if we give it IM. And if we give it intranasally, it's again about that 2 to 10 minute range. So the duration of action is around 20 minutes to 2 hours, and if it's short, and it is shorter than a standard narcotic. So there are some times that we may have to redose the patient with narcan because our narcan will wear out before the narcotic in the bloodstream wears out. So again, when the narcan finally hits, there you go. Whether it's by the patient getting really upset or the patient vomiting, and we're going to talk about that when we get the side effects. So we use it on an altered mentation patient. If we don't know why that they're altered, we can give narcan, but especially if we suspect narcotic overdose, okay? And so the drugs that we've got some hydromorphone, fentanyl, oxycodone, heroin, codeine, paregoric. All of these are opiate derivatives, okay? So if you're seeing these type of drugs out there, and those are the big ones that you're going to see out there, especially fentanyl patches. They love putting extra fentanyl patches on, and they quit breathing because of it. A narcotic, guys, that's the problem with it, is it causes respiratory depression. The good news about narcan is it reverses that respiratory depression, okay? Now, again, synthetic, if they are, it also works on the synthetic drugs as well, okay? And may be useful in an alcoholic coma. They've kind of proven that not necessarily true, but we can try it. But I will also tell you, the last thing I really want to do is wake up a drunk in the back of the truck and kill their buzz, okay? So again, someone overdosed in my parking lot at my work, and I successfully used Narcan. Yay! But guys, a little humor with this, something to ponder. So if the kid does have an allergic reaction, why aren't they passing out EpiPens for free? By the way, EpiPens are about $300, but yet the junkie can get a $200 dose of Narcan free of charge. I'm not saying that people should die, but I am saying maybe they ought to give up the other stuff for free as well. So again, these are some of the things that can cause it. The biggest thing, by the way, the reason that you get VTAC or VFib or tachycardia with the heart is usually the coming out effects of it, and it shocks the system severely. So we want to actually, again, when we're giving it as the EMT level, again, you're going to give it, that's why kind of intranasal spray or a slower dose is not necessarily a bad thing, all right? It can cause seizures. It can cause a person to sweat really bad. It can either drop pressure, or once they get the adrenaline dump into their system, it'll cause the pressure to shoot up, okay? And again, giving it IV and you slam it IV can cause these guys right here, VFib, VTAC. No, 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 no. So if you're going to give it IV, give it slow, and we'll talk about that here when we actually dose it. You're going to get a lot of nausea, and yes, if you slam it, you are going to get a barf. You're going to get vomiting everywhere, okay? They can get withdrawal symptoms, by the way, if they use it in a neonatal patient. Okay, for that matter, an adult patient, but it really causes some bad side effects for the neonates. Okay, use caution with intubated patients because you're probably going to bring them out of their euphoric state, and we don't want to do that. And if you got a narcotic addicted mom, use really carefully with those babies. Really small doses work up to that. Again, usually the bisulfate is alkaline solutions. It doesn't work too well. So again, don't put it with your sodium bicarb, anything like that. I think that I very much believe this is true. I think that if you're a diabetic, you should get insulin for free because the people that are the drug users are getting a 300 dose of Narcan for free. I don't actually see the difference there. Now, again, guys, it can cause seizures and bowel movements in patients if it's pushed too rapidly. It can also cause them to throw up if you give it too rapidly. So be very careful when you do that, okay? And why would it cause violent behavior? You just killed their buzz. Of course it's going to kill. They're going to be very violent because you just ruined their high, okay? And so when we give this drug, guys, I like to give it nice and slow. What we want to do is stop the respiratory depression part of it. I don't want to bring this guy all the way out of his buzz, okay? I want him to remain cool, calm, and collected, okay? The half-life, by the way, is 60 to 100 minutes. That's roughly about when half of the drug wears off, okay? And if you get repeated administrations, again, you're probably going to have to do that if you have too much Narcan. You might actually have to start a Narcan drip on them, in which medical control will give you orders in which to do that. If it's a non-narcotic, non-opiate drug, again, it's going to have very little effect on that patient, all right? The most standard, guys, that I see is, and a matter of fact, I'm going to add one in here. The one that I'm going to add is it's going to be a 2 milligram intranasal spray. So that's the other one we're going to add on to this one. So that's the most common one. And again, EMT-wise, that's what you're going to give. I don't necessarily disagree with that. It works very good intranasally. Matter of fact, I kind of discourage doing it via the IV route because, again, problem is the IV route, we usually give it way too fast. If we know that we have a narcotic overdose, understand that 2 milligrams might not be enough. We may actually have to go up, okay? And then fentanyl, by the way, might require even larger doses. The current one, by the way, that's come out is called Gray Death, carfentanil. It only takes a very small amount of this stuff to render you unconscious. Okay, it's a horse tranquilizer is what it is, but they've been using it on the humans, and the problem becomes, again, it doesn't take much, and you might need to give 10 milligrams of Narcan just to get that person to start breathing again, okay? So be aware of that. Again, when you get hit with a Narcan for the third time this week and your family asks, are you done yet? I didn't hear the bell ring yet. Yep, there you go. Again, if they're less than 5 years of age, I usually give 0.1 milligrams per kilogram. Go with what your length-based tape says. And then repeat as needed. If they're 5 years of age or older, 0.2 milligrams per kilogram. Up to the adult dose, by the way. Don't go over 2 milligrams, all right? Don't go over 2 milligrams on these kids, all right? Make sure that you don't do that. Yeah, there we go. This is how we should distribute it. There you go. Again, so routes that we're going to give it. We're going to give it IV. We can give it IO, IM, intramuscular, subcutaneously. We can give it down the ET tube. But I will tell you guys that the intranasal route, again, this is the one that has become the most common that we give it. Again, the police officers, pretty much everybody, the known people that are in these drug dens, they give them the Narcan so that they go too far on their high that they can kill the buzz. All right, in pregnancy class B, it's a pretty safe drug to give for pregnant patients even, and you don't want them hypoxic because if mom is hypoxic, baby is hypoxic, and of course that is bad. Guys, don't be this guy. walking into the ER and then you decide to slam the Narcan. Yeah, and then transfer care. What's going to happen in about 3 minutes? They're going to start throwing up like crazy. Give it slow, okay? Give it intramuscular. Give it intranasal, okay? Really, they have less side effects when you do that. All right, that's going to end it for this one, and I'm going to see you guys on the next video.